Billions of people have diseases in the world. Some are genetic, some curable, some only last a day while others a lifetime. Still, receiving the news that you have a disease will always be heartbreaking. Autoimmune hepatitis is a rare disorder that affects females 4 times as often as males, and there are approximately 24 per 100,000 cases of autoimmune hepatitis in the world. An incurable chronic disease, autoimmune hepatitis, is a disease without any cure that will last your whole life. Your immune system normally attacks bacteria, viruses, and other invading organisms. It is not supposed to attack your own cells. If it does, the response is called autoimmunity. In autoimmune hepatitis, your immune system attacks your liver cells, causing long-term inflammation and liver damage. What causes autoimmune hepatitis, you might ask? Scientists don't know why the body attacks itself in this way, although heredity and prior infections may play a role. Autoimmune hepatitis is a very serious disease because the liver is an organ necessary for the body to function. The human liver is the largest internal organ in the human body, which is on average 3 pounds and serves many critical functions. It stores fuel for the body, glycogen, which is made from sugars. When required, glycogen is broken down into glucose, which is released into the bloodstream. The liver also helps to process fats and proteins from digested food. The organ makes proteins that are essential for the blood to clotting factors. It processes many medicines which you take. It helps to remove or process alcohol, poisons, and toxins from the body. The liver also functions by making bile, which passes from the liver to the gut down to the bile duct. Bile breaks down the fats in food. Autoimmune hepatitis is a disease that comes with multiple symptoms. Some of these symptoms will include fatigue, abdominal discomfort, yellowing of the skin and whites of the eyes called jaundice, an enlarged liver, abnormal blood vessels on the skin called spider angiomas, skin rashes, and joint pains. Autoimmune hepatitis first came under clinical notice in the late 1940s, and since then, more information has been gathered since its discovery. There are 2 forms of the disease. Type 1, or classic autoimmune hepatitis, is the more common form. This is the type that mostly affects young women and is often accompanied with other autoimmune diseases. Type 2 autoimmune hepatitis is less common and generally affects girls between the ages of 2 and 14. There are a variety of ways to diagnose and to treat autoimmune hepatitis. When being diagnosed, doctors will often perform blood tests. Testing a sample of your blood for antibodies can distinguish autoimmune hepatitis from viral hepatitis and other disorders with similar symptoms. Antibody tests also help pinpoint the type of autoimmune hepatitis you have. In some cases, doctors will use a liver biopsy to confirm their diagnosis of autoimmune hepatitis. Liver biopsies are used to determine the degree and type of liver damage. The treatment for autoimmune hepatitis can vary person to person. Oftentimes, the patient is treated with high-dose steroids. Steroids suppress the immune system, which will lower the damage that the immune system can do to the liver. Since autoimmune hepatitis is not curable, patients are usually medicated for years and sometimes for life. Long-term steroid use can have side effects such as thinning of the bones called osteoporosis, weight gain, and increased pressure in the eye, glaucoma. In some cases, many people need a liver transplant for treatment. A liver transplant is needed when the patient does not respond to treatment and the medications are not working for them, or if the patient is diagnosed with late stage of the disease and have severe scarring of the liver, also called cirrhosis. While living with autoimmune hepatitis, there are a few things that will keep your liver healthy. Ideally, anyone with inflammation of the liver should not drink alcohol. If you already have liver inflammation, alcohol may increase the risk and speed of developing cirrhosis of the liver. Diet is not yet proven to have a huge effect on autoimmune hepatitis, but certain foods are seen to be beneficial or non-beneficial to eat when you have the disease. It would be best to stay away from foods that are known to have inflammatory properties. This means these foods will worsen the liver swelling and inflammation. Foods that will inflame the liver include meat, dairy, sugar, and alcohol. Foods that are best for the liver include fruits, vegetables, and nuts. Personally, my own autoimmune hepatitis had dramatically gotten better after adopting a vegan diet 3 years ago. Exercise is very important when living with autoimmune hepatitis. As seen before, long-term steroid use can cause osteoporosis, which is harmful towards bones. High-impact exercise will strengthen bones and help prevent your bones from weakening due to the steroids. The prognosis of autoimmune hepatitis is fairly good. A prognosis means the likely course the disease will take. Without treatment, nearly 50% of patients with autoimmune hepatitis will die in approximately 5 years, and most patients will die within 10 years of disease onset, if untreated. But if treated, most patients respond to therapy, and the 10-year survival rate is approximately 94%. About 65% of patients enter remission within 18 months of therapy, and 80% within 3 years. Keep in mind, remission means to have the disease be less serious. It does not mean it is cured. But after 3 years of remission, about 80% of patients will relapse. The AST-ALT ratio is the ratio between the concentrations of the enzymes aspartate transaminase and alanine transaminase in blood. It is measured with a blood test and is useful in medical diagnosis to see the cause of liver damage. Normal levels of AST and ALT may slightly vary depending on the individual. Typically, the range for normal AST is reported between 10 to 40 units per liter and ALT between 7 to 56 units per liter. Mild elevations are generally considered to be 2 to 3 times higher than the normal range. In some conditions, these enzymes can be severely elevated in the 1000s range. When I was diagnosed with autoimmune hepatitis in 2011, I had a severely elevated ALT of 1,250 units per liter. Like most other diseases, autoimmune hepatitis can acquire a few complications. In some patients, the patient could have enlarged veins in their esophagus. When circulation through the portal vein is blocked, blood may back up into other blood vessels, mainly those in your stomach and esophagus. The blood vessels are thin-walled, and because they're filled with more blood than they're meant to carry, they're likely to bleed. Massive bleeding in the esophagus or stomach from these blood vessels is a life-threatening emergency that requires immediate medical care. Another complication is fluid in your abdomen called ascites. Liver disease can cause large amounts of fluid to accumulate in your abdomen. Ascites can be uncomfortable and may interfere with breathing and is usually a sign of advanced cirrhosis. Liver failure occurs when extensive damage to liver cells makes it impossible for your liver to function adequately. At this point, a liver transplant is needed. Like said before, type 1 autoimmune hepatitis is usually accompanied by other autoimmune illnesses, such as celiac disease, which is an autoimmune disease in which people cannot tolerate gluten because it damages the lining of their small intestine and prevents absorption of nutrients. Crohn's disease, which causes inflammation and irritation of any part of the digestive tract. Graves' disease, the most common cause of hypothyroidism in the United States, and Hashimoto's disease, a form of chronic inflammation of the thyroid gland.
So I was diagnosed with an autoimmune disease in my late 30s. It's called Hashimoto's. It's an autoimmune disease of my thyroid system. And what it is the immune system attacks my thyroid and causes fatigue and dry skin and muscle pains and stiffness. It's very uncomfortable. I think the struggles of having this autoimmune disease is remembering to take my medication every day, because if I don't, the disease will worsen. So I think taking the medication is the number one problem, but also having so many doctor's appointments and tests and all types of issues with going to the doctors and taking blood tests and having to fast before them and everything.
In conclusion, autoimmune hepatitis is a disease of the immune system in which your immune system cells will attack your liver. This can cause multiple symptoms through your lifetime. This disease does not have a cure, and it is also chronic, meaning it lasts your entire life. Thank you for watching.